Over 10% of the world population above 60 years of age have some degree of osteoarthritis, and by 2050, this number will be over 15% according to United Nations, and 1/3 of these will be severely disabled by the disease. And this is just one type of arthritis. 1 in every 4 adults in countries like the USA have arthritis according to World Health Organization (WHO). Arthritis has even been dubbed as the oldest crippling disease known to man by the Arthritis Foundation. So, what is arthritis? We brought in a doctor to help us explain.
Hello, my name is Dr. Jogona Mwangi. Here we treat all types of patients, many types of patients, and one of the commonest complaints that comes to the doctors here in the hospital is arthritis. Arthritis is inflammation or pain arising from the joints of the body.
The pain arising from arthritis can range from mild to severe. About 1 in every 4 adults with arthritis in countries like the USA report severe joint pains. Joint pains arising from arthritis can be distracting, distressing, and disheartening. People living with arthritis are also limited in their activity, which can lead to frustration. There is no known cure for arthritis, but its effects and symptoms can be managed. But arthritis is not a single disease. In fact, there are more than 100 types of arthritis and related diseases. There are, however, 6 main types of arthritis.
There are several types of arthritis. The commonest arthritis worldwide is osteoarthritis. Osteoarthritis is degeneration or aging of the joints, with the capsules of the joint becoming eroded, and you have pain and swelling and loss of function. You are not able to walk, in pain, and the muscles around your joint become weak as a result.
The types: osteoarthritis, rheumatoid arthritis, gouty arthritis, septic arthritis, reactive arthritis, psoriatic arthritis. Osteoarthritis is estimated to be the 4th leading cause of disability in most countries worldwide and is most common among aging and obese individuals. It is estimated that around 10% of the worldwide population who are 60 years or older have symptoms of osteoarthritis.
The other more serious form of arthritis is rheumatoid arthritis, which is not fully understood. It is suspected to be what we call autoimmune. Your body forgets its own joints and starts destroying them. It's very serious. It can also affect your eyes, can affect your blood vessels and your lungs. The other types of arthritis, like gouty arthritis, or what we call gout, which is deposition of acid, uric acid, crystals in your joints, causing very severe pain. And typically the joint that is first affected is your big toe. It's common in people in affluent states, people who drink a lot of alcohol and eat a lot of protein, like animal meat. Other types of arthritis include septic arthritis, that is pus in your joints, common in children, and also very serious because it can destroy a child's joint and cause very severe difficulties later on in that child's life. Then there's a common cause of arthritis known as reactive arthritis. This is the type of joint pain you experience after other infections. Even simple things like a common cold can give you a reactive arthritis, that is pain in your joints because you've had previous infection. Could be in your abdomen, could be in your chest, could be your throat, normal infections. Then there's a special type of arthritis known as psoriatic arthritis. This is arthritis that results from a skin disease known as psoriasis. So it's fairly rare, but once it's there, it can cause arthritis typically of your fingers, and it's a type of arthritis.
The most common of these, osteoarthritis.
Osteoarthritis is an age-related type of arthritis. Therefore, it's not an inflammatory type. That is, it's not your body attacking your own joints, but it's your joints degenerating, they're aging.
According to the World Health Organization, osteoarthritis is a long-term chronic disease characterized by deterioration of cartilage in joints, which results in bone rubbing together and creating stiffness, pain, and impaired movement.
The joint has the surfaces that touch each other are lined by something called cartilage. That cartilage is the one that first of all starts to degenerate. It degenerates so that your bones almost oppose on each other, causing the lower bone below the cartilage to become thick and painful as the joints move. So that is the main cause. So it's an aging type of arthritis.
While osteoarthritis is related to aging, it is also associated with a variety of causes or risk factors, including obesity, lack of exercise, genetic predisposition, bone density, occupational injury, trauma, and gender.
If you use a particular joint so often, it can result to wear and tear, typical wear and tear. Also, previous injuries in those joints can cause degeneration, faster degeneration. There are also genetic reasons for this type of arthritis, so that you find families in which this is prevalent, pass it on to their children, and so on and so forth.
The most common type of arthritis in Kenya by far is osteoarthritis. Knee, hip, hand, and spine are typically the affected joints. In a study done among 2,100 patients with rheumatic diseases at Kenyatta National Hospital, 201 patients had knee, hip, or hand osteoarthritis, giving a prevalence of 9.6%.
The joints that are affected with osteoarthritis are typically your cervical vertebra, the vertebral column in your neck, and the lower back, which is the commonest presentation in older people. They come to hospital with lower back pain. Also, your hand joints are affected, your hip, and your knees.
And there is a reason why these are the most affected joints.
The hip and the knee are the weight bearing, including your lumbar spine. The spine in your lower back, the lumbar spine, is the one which bears most of the weight, plus your hips and your knees. So they are easily susceptible to osteoarthritis.
Some of the joints in your body are not affected by arthritis.
Your elbows, your shoulders are spared, and your ankle joints are also spared. They are spared. They don't get osteoarthritis.
While osteoarthritis is not necessarily life-threatening, it is the single most common cause of disability in older adults. According to WHO, it has potentially devastating effects on health-related quality of life and will represent an increasing economic burden in the future. Moreover, pain and physical disability brought about by osteoarthritis also affect social functioning and mental health, further diminishing the patient's quality of life.
The problem with osteoarthritis is because it destroys your joint, causing a lot of morbidity. That is, it can tamper with your day-to-day activities, unable to do a lot of things.
Osteoarthritis pain, swelling or stiffness may make it difficult to perform ordinary tasks at work or at home. Simple acts like tucking in bed sheets, opening a box of food, grasping a computer mouse, or driving a car can become nearly impossible. When the lower body joints are affected, activities such as walking, climbing stairs, and lifting objects may become difficult. When finger and hand joints are affected, osteoarthritis can make it difficult to grasp and hold objects such as a pencil or to do delicate tasks such as needlework.
Older people, they are not able to walk steadily, and therefore they are prone to fall. And when they fall, especially older women, considering that then their bones are also a bit soft, osteoporotic as we call it, if they fall, they are more prone to fractures, and that can cause significant morbidity, even mortality. So that's the problem with osteoarthritis.
So, how do you know you have osteoarthritis?
The typical presentation of osteoarthritis is pain and occasionally stiffness in those joints. So with your hands, they are stiff, they don't bend. You try to bend your finger and for some reason it's stiff. There's some pain, especially with movement. Sometimes the pain presents at night when you're still. That's when you notice you're having some pain in your knees, in your hip, or even in your hands.
Additionally, you might also experience tenderness, clicking or cracking sound when joint bends, and mild swelling around the joint. Osteoarthritis is a chronic, meaning long-term disease and there is no known cure. There are, however, a number of effective ways to manage osteoarthritis symptoms and to improve the quality of life.
First of all, there is a non-pharmacologic treatment, that is a treatment without drugs, which includes certain exercises to strengthen the joints.
While it may be hard to think of exercise when the joints hurt, moving is considered an important part of the treatment plan. Studies show that simple activities like walking around the neighborhood or taking an easy exercise class can reduce pain and help maintain or attain a heavy weight.
As the joint becomes destroyed, you stop using that joint often, and the muscles around that joint become weak as a result, because joints need exercise to be strengthened.
Strengthening exercise builds muscles around osteoarthritis affected joints, reducing the burden on those joints and reducing pain. A range of motion exercise helps maintain and improve joint flexibility and reduce stiffness. Aerobic exercise helps to improve stamina and energy levels and also help to reduce excess weight.
In that absence, those joints become weak, and that's how people are prone to falls. So one of the management of those patients with osteoarthritis is exercise. Exercises to strengthen those joints.
You, however, need to be careful with exercises. Here is why.
With regard to exercise, however, it is good to to discuss this with your trainer or with your doctor, the best exercises that are suited for you, so that you don't engage yourself in an exercise that can make it worse for you. You don't want to go and do weights that are, that are a great way of toning your body, and in the process, you slip a disc. That is, in your lumbar spine, you could actually slip a disc, the intervertebral discs, and make it much, much worse for yourself. So the best way to do it is to do the general exercises, walking, a small jog, light weights, aerobic exercises.
Another great way to manage osteoarthritis is weight management.
Because the heavier you are, the more weight you bear on your hip, on your lower back, on your knees, predisposing them to osteoarthritis as time goes by, because then your joints are bearing too much weight, destroying your cartilage in the process. Therefore, weight loss is part of the management.
In the management of osteoarthritis pain, painkillers can also be used to help ease the pain.
The obvious painkillers like paracetamol, Panadol. There are other drugs that we call them NSAIDs, non-steroidal anti-inflammatory drugs.
It is, however, important to remember that these painkillers don't help improve the condition of your joints.
And therefore, the painkillers, although they help, they don't do anything to improve the condition. They just manage the symptoms to enable you get by life without a lot of difficulties.
Paracetamol and non-steroidal anti-inflammatory drugs are currently endorsed by clinical guidelines to treat osteoarthritis pain. But emerging evidence has challenged this recommendation and revealed the potential for adverse effects.
Drugs like ibuprofen, diclofenac, and meloxicam, these molecules, they're good with regard to pain management, but the side effect profile can be very limiting. It's good to mention that these drugs can cause gastritis. They can erode the lining of the stomach, they can hit your kidneys, and they can elevate your blood pressure. So if you're having these other conditions, it's good to have caution in using these drugs.
This new evidence has increased public interest to alternative treatments, leading to the endorsement of supplements for the management of osteoarthritis. Currently, 69% of patients with osteoarthritis take some form of dietary supplements for their condition, often used alongside or as an alternative to first-line interventions such as exercise. Glucosamine and chondroitin together account for a third of all supplement use in the management of osteoarthritis.
And one of the common joint supplements is chondroitin and glucosamine. These are joint supplements that assist the joint in regenerating itself and therefore reducing the pain and the need for even painkillers as you continue to use them. Most of them come combined with calcium, which helps in joint strengthening and bone strengthening, because calcium is a very important element in bone remodeling and bone repair. And most patients who get this condition, as we said, as a result of age, by then also have problems with their own calcium. And therefore, most of these supplements come in handy because they supplement your calcium and they give you something that can help your bones remodel and repair themselves. Drugs like glucosamine and chondroitin and others.
Glucosamine and chondroitin are structural components of cartilage, which is the tissue that cushions the joints, and are both produced naturally in the body. Glucosamine is required by the body to regenerate or reform joints and tendons, while chondroitin is used to restore joint fluids and therefore increases joint flexibility. One supplement with the combination of chondroitin and glucosamine is called Arthritis. It is widely used by doctors countrywide for the management of osteoarthritis and with a very good success.
One of the products I use with my patients with osteoarthritis is a drug that has a combination of calcium, glucosamine and chondroitin. We call it Arthritis, and with a lot of success. Many patients appreciate this drug because it helps them use less and less painkillers. They have improvement in their symptom score and general improvement in their arthritis. I recommend it.
Arthritis is beautifully packed in a light blue packet and can be found in most pharmacies countrywide or delivered anywhere within Nairobi when you purchase from the company's online shop www.medcure.co.ke. Patients who use Arthritis over the long term have shown improved joint health and reduced reliance on painkillers. For any inquiries, kindly contact us through the number 0710 710000 and follow us on Facebook for regular education on arthritis and other diseases.